Like most men, I thought old age was something that was going to happen to somebody else. I was fit, I had no complaints. And suddenly you're sitting there with your urologist and he's saying you've got prostate cancer. And suddenly it's like, whoa. And that begins the process of researching. What are my options? What's my chances? How's this going to affect me? As much as I certainly wanted to stay alive, you don't just want a life, you want a life. You want to be able to do the stuff you want to do. And I really felt that Dr. Tiwari was on my side and was my brother in terms of wanting to make sure that he would do whatever he could, that I would be able to continue to live the life that I wanted to continue living.
We are celebrating today some of the victories we have made in the journey of our patients' healthcare. This is worth celebrating what journey they go through, what they face, and how we have fought against them suffering.
If I could help Dr. Tiwari save one more person or enable one more guy to enjoy more time with their family, it's well worth being able to tell my story.
For over 10 years, under Dr. Ash Tiwari's visionary leadership, the Urology Department at Mount Sinai has played a pivotal role in shaping and transforming the landscape of patient care.
Department of Urology, Center for the Prostate Cancer, is a sum total of experts who are working together in making a dent on this cancer. Not just helping them in an early diagnosis, not just helping them in treating the cancer, but also helping them by making changes in the quality of life, by making an effort so that they live longer and they live longer with a better quality of life.
Ash, he never gives up, and he will never stop working toward a cure of prostate cancer. He's driven in the best way possible.
We were married in May of 2014. I was diagnosed with cancer a few months after we had retired and moved to our forever home in Maine. It was sort of like, life says, okay, great that you got married, great that you retired, found a lovely place to live. We're gonna throw you a curveball.
I was about to celebrate my 60th birthday, and I'd sent out invitations saying, Terence turns 50 again. And all of a sudden, I had cancer, and you don't even know if you're gonna make it to 65.
There are so many different ways our department has been very innovative, working together to make a dent, come up with the novel strategies, and still be human, be personable, be in the trenches with the patient, so that the high-tech meets the human part of the healthcare, and that's what our team has been doing.
It really is a difficult thing for an individual to talk about because so much of male identity is associated with, sexual function, urinary function. So when you finally get down to brass tacks of actually contemplating the procedure and planning for it, you're on a bit of an emotional roller coaster. And how a particular surgeon and his team come across to you is a big deal, and it makes a difference about your level of confidence and assurance that you have for a successful outcome.
He came into that room and we ended up talking about cricket. There was a bonding that I think took place.
And the thing that really compelled me to consider Dr. Tiwari and his surgical team as my team was Dr. Tiwari has a very unique personal warmth that comes out when you first meet him. And he exudes a concern not only for the patient, but also their family, because cancer affects the entire family.
We talked about my situation, what my lifestyle was. I wanted to be fit. I wanted to keep playing golf. I wanted to keep up with my other athletic activities. And then he actually showed me a video of a robotic surgery, which blew me away.
With the robotic surgery, we have a very precise understanding about where exactly the cancer is for this patient, where the nerves are traveling, and what is the best plane to separate them out. And what is the most delicate way to do it? We have defined the techniques, We have defined the grades of nerve sparing. All that pulled together within artificial intelligence tools gives us a better chance of recovery. In the journey of prostate cancer, one of the biggest challenges we feel is that sometimes we find the cancer a little late.
My name is Virgil Kaiser. I'm 67 years old, and I live in Canarsie, Brooklyn. When I found out that the mobile van was at my job to screen men for prostate cancer, I was really happy and glad to do that. So I went and I got screened. It comes out that I had an elevated PSA.
There is a disparity in healthcare, especially for the prostate cancer, and there are certain groups who have a more aggressive cancer.
I was really quite disturbed by it and in shock, really in shock. I never smoked cigarettes, I never drank alcohol, I never did drugs. I always ate healthy foods and exercised. I'm glad I didn't say to myself, since I don't have any symptoms, I'm not going to get tested. But you really don't have to have any symptoms. I had none of the symptoms, nothing at all. And I was in the very first stage. I was in stage 1.
I thought it will be easier to find a cancer early if I show up at the doors of people where they are living. That was the thought behind the mobile unit, so that they can just come out, talk to my team, and get them tested.
Early detection is the key.
We are less than 3 years, and we have already touched 10,000 men who we have reached, and significant number of these men had cancer.
The mobile van saved my life, it did.
The first thing you feel when someone tells you that you have prostate cancer is you feel immediately out of control. Ultimately, it's your decision as a patient at what path of care you're going to pursue. And my immediate reaction was radical prostatectomy was not the first choice on the menu. Dr. Tiwari suggested that there are more alternative treatments that can assist in either mitigating or eliminating the disease altogether.
Our research is what defines the next generation of treatment. We have a whole strategy as to how to revoke, how to provoke, how to ignite, how to retrain our immune system where the tumor is forming. We have a clinical trial going on in which we call personalized genomic vaccine.
The clinical trial that I ended up in was a phase 2 clinical trial where you train the immune system to identify the prostate cancer cells as alien cells that the immune system should attack. And basically uses your own immune system as the swords to break those cells down. It's given me hope in the sense that it has mitigated any progression of the disease, but it's also allowed me to feel that I'm not jumping right into some radical treatment that could be avoided if possible. So with that, I feel like I'm buying some more years of my life in a quality way.
Now, 5 months after surgery, I have had 3 consecutive PSA readings of undetectable. So thank you, Dr. Tiwari and your team.
I wanted to tell my story because it brings awareness and so men can take actions and get treatment.
If I can save a single life, share my story is worth it.
Steve was brilliant, but that doesn't capture him. He was the finest person I've ever met, the kindest person you would ever meet. His contribution to science was to articulate a greater understanding of post-traumatic stress disorder. How did trauma lead to the disability associated with PTSD and all the symptoms? And by understanding resilience, we could come up with better treatments for PTSD. Steve Southwick died of prostate cancer because we didn't have the treatments available to cure him. And I hope this award motivates prostate cancer researchers to come up with a cure. So great men like Steve Southwick would not have died.
Dr. Stephen Southwick Award is an award to a researcher who has made the most impact in the journey of patients with prostate cancer. Dr. Natasha Capriano is one of those scientists which totally embodies the talent, the passion, the skill, and the desire towards getting an answer for these patients and developing a better way of treating metastatic prostate cancer.
What really drives research is what drives me since I was very young is really the effort to reduce suffering of any kind. And this is something that my family, my parents and grandparents installed in me. Not only to give back, but to really do whatever we can as scientists, as physicians, as human beings to help reduce the suffering of other people. In really defining cancer research, I'm very passionate to my core about what I believe in, and I'm very loyal to my dream, and I won't give up.
What sets her apart from everyone else is her purity of heart and her total desire in making a change in men with prostate cancer journey.
My research specifically focuses on advanced prostate cancer. Our goal is to really strike the prostate tumor cells before they become too aggressive, before they become dangerous towards metastases, in order to take the life of the patient. By establishing the molecular profiling of these tumors earlier on, then we can sequence the treatment approaches, which can really make a difference in the patient's response.
She is one of embodiments of what we call this translational scientist who has devoted her life to prostate cancer care.
This award, in honor of Dr. Southey's memory, puts a human face to this goal. We all work very hard, but it really is to be driven and really apply resilience in our lives and come through like a phoenix, being resurrected from the ashes and being able to make a difference and see the difference in people's lives when the results are out.
We don't want to have more Dr. Stephen Southwicks who fought this battle very gracefully with a lot of courage, with a lot of resilience.
We have to continue fighting until we find the answers, until we find the cures. Giving up is not an option. Failure is not an option.